Hello and welcome back to the Healthcare Motivation channel, where we share insightful perspectives for healthcare professionals. If you find value here, please like, subscribe, and share this video. By sharing this, you help YouTube to spread the word and support healthcare professionals as they care for others. Today's topic is about the nurses' strike in New York City. What is happening in New York right now is not just a labor dispute, it is the largest nurses' strike in the city's history. This strike has become a turning point for patient safety and the future of healthcare in this city and beyond. When thousands of nursing professionals are willing to step away from the bedside, it is not because they care less. It is because the conditions have become so unsafe that their ethical duty demands a different kind of action. Today, nearly 15,000 nurses from major New York City hospitals have walked out together. Many are members of the New York State Nurses Association, standing shoulder to shoulder outside institutions like Mount Sinai, Montefiore, and other healthcare facilities that form the backbone of healthcare for millions of New Yorkers. Nurses began this strike after negotiations collapsed when repeated warnings about unsafe staffing and unsustainable workloads went unheeded. To understand the scale of this moment, let's zoom out for a second. In the United States, there are over 4 million registered nurses, with millions actively working in hospitals, clinics, and communities every day. New York alone is home to hundreds of thousands of licensed nurses, with New York City hospitals consisting of tens of thousands of nursing professionals who keep the healthcare system running 24 hours a day, 7 days a week. So when 15,000 of these nurses decide that the status quo is not acceptable, this is not just a minor staffing issue. This is a major warning signal from within the core of the health system. So why did these nurses go on strike? Well, at the center is one phrase you will hear again and again, and that is safe staffing ratios. If you or someone you know has experienced unsafe staffing ratios, type I in the chat. The demand for safe staffing ratios is not a campaign slogan. It is a measurable life or death variable that needs to be addressed. Research studies have shown that every extra patient that is added to a nurse's typical assignment can increase the risk of injury or death by approximately 7%. This is not because nurses suddenly care less. This is because human limits are real. When a nurse is responsible for 5, 6, or more sick patients at once, the probability of a missed assessment, a delayed response, or a medication error rises sharply. These nurses are demanding contracts that do more than just encourage safe staffing. They want enforceable ratios written into their agreements, with language regarding metrics and consequences when hospitals chronically understaff. Nurses are also seeking fair pay, wages that keep pace with the cost of living in the city and reflect the complexity and risk of modern nursing practice, along with other benefits that protect nurses. Hospitals have described some of these proposals as too expensive, but nurses are making a different calculation. Nurses state that the cost of not fixing the problem is paid in staff burnout and preventable patient harm. History tells us that this kind of protest can change more than just a paycheck. This advocacy helps to promote safety and quality of patient care. Over the years, nurses have used collective action to advocate for laws, staffing standards, and safety regulations that have saved countless lives. Many of the protections that exist today, such as those around infection control, etc., were won by nurses who were willing to take a risk, face criticism, and hold the line. So, if you are a nurse who stepped out on strike, or if you are a nurse watching from another part of the country and you are wondering what this means for the nursing profession, know that this strike is not a sign that nurses have failed their patients. This is evidence that nurses are advocating for their patients. Nurses are advocating in the only language that the system cannot ignore. Your expertise is data. Your reports of exhaustion due to unsafe conditions is data. Sharing your experience of a near miss while working short-staffed is data. So for those watching, patients, families, policymakers, the message is this: nurses care for their patients. When nurses say enough, they are not threatening health care. They are trying to save it. Thank you for tuning into the Healthcare Motivation channel. If you found value here, please click like and subscribe and share this video with someone you know. When you share this video, this pushes the message out to others to help spread the word. So until next time, stay motivated, stay connected, and we will see you in the next video.